Welcome back, everybody. We're awaiting the President of the United States and the Coronavirus Task Force. When they step to the podium, we'll bring them to you live here on the Salcedo Show. It's been the White House's practice to come on during our program last week or so. Also want to welcome to the program our first panel, Dr. Jonathan Baugh. He's the Chief Medical Officer at Remote Health Solutions. That's a small business owned by veterans that provides industry-leading telemedicine devices and remote medical services. Also joined by former New York City Police Chief and Newsmax contributor Bernie Carrick. Gentlemen, thank you so much for being here.
Thank you.
You bet. Thanks for having me on.
Doctor, how important is it to maintain social distancing in areas that are not New York and New Jersey around the rest of the country? Tell us about that first.
You know, I think that's a great point to bring up because there obviously is a difference. And if we look at New York, New Jersey, we look at these very dense metropolitan areas, that is the key factor that is making it such a huge issue right now. I just was talking with a colleague of mine who's practicing in the Bronx, and the level of care that they're going through, being on the front lines in the true epicenter, is sort of unfathomable for most people, I think. And so if we can practice the same social distancing in other places, I think that that's smart. I think there are going to be some areas in the country where they're never going to see the same thing that they see in New York. But if we can limit the number of patients primarily right at the beginning through social distancing and self-isolation, then I think that we're fighting that fight early and often.
Yeah, a lot of businesses transitioning to working at home. There are some jobs, however, you can't do from home, and that's policing is one of them. And Mr. Carrick, 5 members of the NYPD have died. 5,600 are out sick, from what I understand. This could be a tragedy in law enforcement. A lot of concerns there. What are your primary concerns?
Well, I think first and foremost to make sure that those that have called out sick or they have symptoms, and keep in mind, if they have symptoms, they are told by the department, do not come to work. So I think it's extremely important that we get them looked at, get them treated if they need it, get them in the hospital if they need it, but also get the PPE, the protective equipment that these men and women need to do their job. Make sure they have masks, make sure they have gloves, make sure they have things they need to do the job so that they don't get sick or they have less of a chance to get sick. You know, they're going to be working a lot of hours overtime. Somebody has to backfill the hours of those that are calling out sick. This is an enormous task, but I have 100% confidence that they can get it done, and they'll do it just like they do every other day when they put their lives on the line for New York City.
Yeah, there you go. And, you know, and not just NYPD, there are police departments all over the country feeling the strain from this. Doctor, some emails we've been getting from viewers asking us, you know, we're coming into the summer months, we're coming into mosquito season, and the questions I'm getting, can mosquitoes bite you, and or bite somebody with coronavirus, go bite somebody else and spread the virus? What is the ruling on that?
Yeah, you know, that was a great question, just because there's so much concern about there and so much that we don't know. But we know that this is an airborne, air droplet transmitted disease. It's not a blood-borne or blood transmitted disease. So really, you should be able to rest with no concern here. Mosquitoes are not going to be the vector for you.
Yeah, Bernie, back to New York, de Blasio. A lot of criticism he's taking. And you know what? I think a lot of lawmakers were caught off guard from coronavirus, but there's criticism being thrown his way that in the midst of overwhelming evidence, he still waited too long to shut things down in New York. And that's the reason why they are the epicenter right now. Any truth in your mind to that criticism?
You know what? I hate the Monday morning quarterback when I'm not there, but I will tell you this. I think that he could have done more in responding to, but I'm also concerned about, you know, where was the reactive and proactive planning for crisis management and disaster response? What if there was a biochemical attack in New York City? Would they have masks? Would they have ventilators? Would they have the equipment they need? This is stuff that, you know, we're 19 years out from September 11th. And the one thing that came out of September 11th and the lessons learned was you have to be prepared for crisis. And this is a crisis that I just personally believe the city was not prepared for, and the mayor should have had people that was really planning, practicing, doing mock drills and tabletop exercises for events like this.
Yeah, and you know what? Before I let you go on De Blasio, Bernie, there's a meme I saw on social media I wanted you to weigh in on, because De Blasio has attacked places of worship, threatening to shut them down, and he's also said that he wants to let criminals out of jail. And the meme said, "Let me get this straight: we want to arrest pastors and we want to release convicted criminals." Your response?
You know what? I think there's an element within the prison system, especially the Federal Bureau of Prisons. I think there's an element and a classification of inmates that can be released to home confinement with electronic monitoring. But what de Blasio wants to do, he wants to do a blanket release, and in that blanket release are violent felons. And I just think it's outrageous. And not only him, there are jails and prisons, state prisons around the country that are doing these blanket releases, and it's wrong.
Doc, I want to get back to you and the dynamic we find ourselves in, this social distancing, this separation our society is forced to undertake. This term, telemedicine, is being thrown around an awful lot, and it's your specialty. If hospitals get overwhelmed, how can telemedicine, swoop in and help save the day?
Two ways that we're working with telemedicine right now, and one is to be able to provide some social distancing, some physical distancing from the patient to the provider. So we can use a device that allows a provider to examine a patient remotely. Stethoscope and EKG and blood pressure, all those things can be done remotely. So that provides that provider an additional level of safety. One of the things that we see is increasing worsening outcomes is increased viral load for these providers, we think. And then the other way that we're really using telemedicine in these scenarios is as somebody comes to the hospital and they might need they may not need to be admitted to the hospital. They're sick. They've got symptoms. They're a mildly or moderately symptomatic patient who is positive or still a person under investigation. We can send a device home with them that's a small device, and we can monitor their vital signs at home. We can reach out to them through telemedicine. So those ways that we can unload the patients that actually arrive at the hospital. And then we should also be using our telemedicine within our provider networks to reach out to our provider and unload the incoming to the hospital to start with.
Yeah, and I can hear you're doing some remote telemedicine right there from the house. Look, last question I have for you, because the administration is talking about therapeutics coming online by the time we reach the summer. These therapeutics could help ease the suffering of a lot of folks out there. However, one problem remains. A lot of our medicines, the vast majority of our medicines, the main components for them are over in communist China. As a physician, as a doctor, how worried are you that China has the ability to hold sway over, even if we do come up with a therapeutic that works, how China can actually leverage that against us?
Yeah, that's a really interesting point, because before this event, before this pandemic came, we in my ER where I practice medicine, we have a list of hard to acquire or unavailable medications. Then when this pandemic happened, we started having the realization that the majority of our antibiotics were coming from China, and I think 40% of the generic medications that we receive come from China or India. And so that's a true concern for us as providers. And we also, so how do we look at that? Well, there are answers here within the States. There are pharmaceutical companies here who have the capability. There are hospital organizations, there's provider networks, there are big pharmas here. The answer is to be able to bring that home so that we can maintain a level of safety and efficiency, and also to be able to protect America. I think that's an important thing for us to be able to look at.
I hope members of Congress are listening to the experts who are telling them the same thing. Mr. Carrick, one last thing to you. We're waiting the President of the United States to get up there and speak to the country, to give us an update on the coronavirus, as he has been doing. There are those in the biased press who want to stop that because they see that the American people are making a connection with their president and they don't like it, so they want to stop that. Plus, you have, it seems, the Democrats now are setting up for another impeachment, alleging that this president has not led on this issue. What is your take on both those?
Well, I think one contradicts the other. For them to say he hasn't led, that's exactly why they don't want him to be seen, because they know his leadership from the very beginning of this, his daily briefings, which I have to tell you, I think he's been overly generous with the press and media in his daily briefings. I don't think he should be out there as much as he has been. I have absolutely no problem with his leadership. And I've been through whether it was 9/11 or anthrax or American Airlines Flight 586 falling out of the sky and killing 286 people. I've been through a lot. I can tell you that I'm extremely happy with the president's leadership.
Dr. Baugh, Mr. Carrick, thank you very much, gentlemen, for being here on the Chris Salcedo Show. It's a pleasure. Still more to come, folks. We turn our attention to the economy. We'll discuss